Hello students, welcome to Medicine Guruji. Today we are going to discuss another important part, that is treatment of hypertension. We have already discussed the details of hypertension in our prior video, that is hypertension part 1. I am your mentor Dr. Avat Kapoor. What we will learn today? We will see about the drugs for hypertension, ड्रग्स की डोजेस क्या हैं, we will see the flow chart of treatment, what are the various choices of drugs, some special scenario we will see, हम देखेंगे causes of resistant hypertension, and then we will see some important things to remember. Drugs for hypertension. As we all know, there are various drugs that are used to treat hypertension. We all know by the famous name antihypertensives. These are classified as diuretics, beta blockers, alpha blockers, vasodilators, ACE inhibitors, calcium channel blockers, and angiotensin receptor blockers. Now we will see each drug one by one. एक जो सबसे important drug है, that is a diuretic. The diuretics example thiazides, hydrochlorothiazide, or loop diuretics. We all know the famous Lasix tablet or Lasix injection, furosemide, torsemide, that is available by a famous name of Ditor. There is also potassium sparing diuretics. Example, aldosterone antagonist, spironolactone, that is available by the name of aldactone. Inhibitor of sodium channel, amiloride. नाउ वी विल सी उनका मैकेनिज्म ऑफ एक्शन क्या है डायूरेटिक्स का. डायूरेटिक्स एक्ट बाय डिक्रीजिंग ब्लड वॉल्यूम एंड कार्डियक आउटपुट. रिमेंबर, they decrease both blood volume and cardiac output, so they decrease peripheral resistance when we give them for a prolonged period, that is in chronic treatment. Side effects are, you can always remember, hypokalemia, hyponatremia, hyperuricemia. This is a very important side effect, very commonly encountered, and hyperglycemia. Hence, they are not very safe in diabetics. Now, coming to the second class of drugs that are very beautifully written here, ACE inhibitors. We all know by the famous name captopril, enalapril, perindopril, ramipril, lisinopril. अब इनका मैकेनिज्म ऑफ एक्शन देखें. ये इनहिबिट एस and formation of angiotensin 2 and blocks its effects. इनके साइड इफेक्ट्स क्या होते हैं? देयर साइड इफेक्ट्स एस इनहिबिटर्स के होते हैं ड्राई कफ, बिल्कुल ड्राई कफ, हाइपोटेंशन एंड एंजियोइडेमा. Always remember, these are drug of choice in coexistent diabetes mellitus and heart failure. Never forget diabetes and heart failure. Now another very important class of drug, now in demand, very much in demand nowadays, angiotensin receptor blockers or angiotensin 2 receptor blockers by the famous name telmisartan, losartan, valsartan, omnisartan और कैंडीसार्टन. इनका मैकेनिज्म ऑफ एक्शन क्या होता है? ये ब्लॉक द एंजियोटेंसिन 2 रिसेप्टर and inhibit effects of angiotensin 2. Side effect, they are much safer than ACE inhibitors. Hypotension is a side effect. Drug of choice Again, they are the same drug of choice in patients with coexisting diabetes mellitus, but generally they are preferred when patient cannot tolerate ACE. A very famous drugs, beta blockers. First we will see the mechanism of action, and then along with the mechanism of action we will see the name. The cardioselective that act on beta 1, atenolol, metoprolol and bisoprolol. The non-selective that is acting on both beta 1 and beta 2, propranolol, timolol and pindolol. Students of MBBS and MD try to learn the cardioselectivity and non-selectivity and combine alpha and beta blockers like labetalol and carvedilol. They decrease rate and force of contraction and thus reduce cardiac output. Very important side effect is impotence. That is very important to remember in male patients. Bradycardia, again very important. They are contraindicated in asthmatics, also not safe in diabetics. But the drug of choice, the beta blockers are drug of choice for CHD, coronary heart disease. Now we are coming to calcium channel blockers, amlodipine, nifedipine. Rate limiting calcium channel antagonists, these are diltiazem and verapamil. इनका मैकेनिज्म ऑफ एक्शन क्या होता है? Calcium channel blockers block the voltage gated calcium channels. They low BP by causing peripheral arterial dilatation. What is the side effect? Always remember fluid retention. The patient will come to you, मरीज आके बताएगा साहब जब से ये एम्लोडिपिन आपने लिखी है, निफिडिपिन आपने लिखी है, तब से मेरे पैरों में सूजन आ रही है. Flushing. It is drug of choice in old individuals, geriatric persons, as they are very useful in stroke protection. Now we will see some vasodilators. The ideal candidate is prazosin. इसका मैकेनिज्म ऑफ एक्शन क्या है? अल्फा 1 adrenoceptor antagonist and cause vasodilatation, reduce peripheral resistance and venous return. साइड इफेक्ट हमेशा याद रखिएगा वेजोडाइलेटर्स का. postural hypotension. They are drug of choice in patients with coexisting BPH, benign prostate hypertrophy. Now we will look at some drug doses. Diuretics, hydrochlorothiazide is an example. The initial dose is 12.5 milligram OD once in a day. The maintenance dose can be from 12.5 to 25. Beta blockers, atenolol, the initiating dose is 25 to 50 mg OD. The maintenance can be between 50 to 100. Calcium channel blockers, amlodipine, 2.5 to 5 mg OD. Maintenance is 5 to 10 mg. Alpha blocker, prazosin, 2.5 mg OD. Initiating dose, maintenance dose is 2.5 to 10 mg OD. ACE inhibitors, ramipril, 1.25 to 5 mg OD and maintenance is 5 to 20 mg OD. Angiotensin 2 receptor blockers, losartan, 25 to 50 milligrams OD and maintenance is 50 to 100 milligrams OD. This chart is very important for residents. Now look at this chart. ट्रीटमेंट ऑफ हाइपरटेंशन. इस फ्लो चार्ट को देखिए. सबसे पहले हम लाइफस्टाइल मॉडिफिकेशन करते हैं. If the BP is not at goal, see the center part. Less than BP not less than 140 by 90, less than 130 by 80 for diabetics or CKD. And now we will see the left and right of second point with compelling indications, without compelling indications. First see without compelling indications. Come to the right side. If the patient has stage 1 hypertension, means systolic BP is between 140 to 159 and diastolic BP is between 90 to 99, thiazide type of diuretics for most may consider ACE, ARB, beta blockers or calcium channel blockers. Now coming to stage 2 hypertension, systolic BP more than 160 and diastolic more than 100 millimeters of mercury, go for true drug combination. For most, you can combine diuretics and ACE or ARB or beta blocker or calcium channel blocker. If the BP is not at goal, see the fourth point, see the last point, optimize dosage or add additional drugs until goal BP is achieved. If again the BP is not controlled, you should go for specialist consultation. Now look at the left side with compelling indications. Drugs for the compelling indications, other antihypertensives as needed. Now, what are the choice of drugs under various situations that are generally encountered? जैसे कि हमें एस्थमा मिलेगा तो ड्रग प्रिफर्ड इज कैल्शियम चैनल ब्लॉकर. डायबिटीज मिलती है पेशेंट में एस इनहिबिटर्स और एआरबी. हाई कोलेस्ट्रॉल पेशेंट्स मिलते हैं अल्फा ब्लॉकर्स. एल्डरली यू कैन गो फॉर बोथ calcium channel and diuretics. And patients with BPH, benign prostate hypertrophy, go for alpha blockers. What special scenario there can be? Example, pregnancy. The preferred drug is nifedipine, labetalol, beta blockers, methyl dopa, and prazosin. For coronary artery disease, beta blockers. They are the gold standard. ACE inhibitors or calcium channel blockers. For CHF, congestive heart failure, ACE inhibitors and beta blockers. Once the symptoms have subsided, then you add beta blocker in a low dose. But never forget nifedipine, labetalol in pregnancy. Now we will be seeing क्या causes हैं resistant hypertension के. Very important is improper BP measurement. Excess sodium intake. मरीज बहुत ज्यादा नमक खा रहा है. Inadequate diuretic therapy. हमारी डोज गलत है. Inadequate doses of medicines. Drug actions and interactions. एक कोई यंग फीमेल है वो OCP पे है. Oral contraceptive pills, NSAIDs. ओवर द काउंटर ड्रग्स. हमारे काउंटर पे बहुत फैशनेबल ड्रग्स मिलती हैं बाय एडवर्टाइजमेंट. ओवर द काउंटर ड्रग्स. ही इज और शी इज टेकिंग एक्सेस एल्कोहल and identifiable causes of hypertension. Very important to remember is improper BP measurement, excess sodium intake, females जो contraceptive pill खा रही हैं, NSAID, contraceptives में mainly hormonal contraceptives, and over the counter drugs. Coming to the last part of slides, things to remember. Hypertension is a major cause of morbidity and mortality and need to be treated. Hypertension is very much undiagnosed, underdiagnosed, and undertreated. Aim of treatment must be to prevent target organ damage. The main target organ damage is kidney and heart, and lifestyle modification is an integral part of treatment. Now we will see a case. A 70-year-old school teacher visits his family physician with history of diabetes. He was controlled on OHA. He complained of fatigue and headache on various occasions. On examination, his BP was more than 178 by 98 millimeters of mercury. He also gave a record of BP recording that was more than 170 by 100 taken by a local physician few days ago. The treating physician made a diagnosis of hypertension. Suggest best possible treatment for this person. I think now it must be clear to you. Use your mind. Try to answer this question by yourself. Now see at a question, look at a MCQ. Which of the following is the side effects of ACE inhibitors? Hyperkalemia, hypercalcemia, hyperglycemia, hypertension, hypomagnesemia. Again, use your mind. I am not going to discuss. You try to find out. Look at another important MCQ. Safest drug for hypertension in pregnancy. ACE inhibitors, ARB, diuretics, methyl dopa. I think the answer is clear to you by even looking. Again, use your mind. Now, use your mind, students. What relevant points you can work out here? Look, she is 45-year-old woman. That is menopausal age. She is taking 2 glasses of wine after dinner regularly. Her blood pressure is not normal in prehypertensive range. BMI is 28. She is overweight. So, what was the ideal management she needs? First important thing is we should keep her on lifestyle modification. She should reduce her alcohol intake, try to reduce her weight. She should be put on DASH diet and then re-evaluated. Now, last case that we discussed, case 2. Rani is 38-year-old. She is attending for a routine appointment about her contraception, for which she uses a diaphragm. Medical history from her records, you noted that Rani's blood pressure has increased since her last check 12 months ago. She does not smoke, drinks 10 to 12 units of alcohol a week, and has no notable medical history. On examination, Rani's first clinical blood pressure measurement is 158 by 94 millimeters of mercury. Her heart rate is 72 beats per minute and regular. So, what you suggest? First, look, she is using a diaphragm. Is diaphragm a risk factor for hypertension? Use your brain. Medical history from her records, that is, she has perfect record that blood pressure has increased since last check 12 months ago. But she is not a smoker, but she is alcoholic, 10 to 12 units of alcohol a week, and has no notable medical history. First clinical blood pressure measurement is 158 by 94. Her heart rate is 72 and regular. So, what should be the approach? Again, we should first take another reading, There should be at least two readings in a correct position on two visits at least. Then we should decide about her treatment, and she should be also be put on lifestyle modification like reduction of alcohol, exercise and dash diet. And subsequently, if her blood pressures are increasing above 140 by 90, then we should decide about the treatment protocol. Thank you, students. Thank you once again. Have a golden career ahead. Thank you.